Today we're going to talk about abuse and neglect. These actions cannot be tolerated in your facility. Individuals who engage in abusive or neglectful behavior towards their residents may suffer civil or criminal punishments. To begin with, you first of all have to understand what constitutes abuse and neglect, and then you need to learn ways to avoid it.
What exactly is abuse? It is defined as verbal, physical, or emotional harm of residents. Punching, kicking, threatening, or cursing are examples of abuse. What is neglect? Neglect is harming residents by ignoring. For example, not feeding a resident or allowing them to remain cold or wet is neglectful. Abuse and neglect are crimes. Residents with dementia are frequently vulnerable because they are not able to protect themselves from abuse and neglect. This means they can't insist that they be treated with dignity either. Remember that dementia, with its erosion of intellectual abilities, does not reduce residents' value as human beings or their value as individuals. There are 3 types of abuse: verbal, emotional, and physical. Verbal abuse can be avoided if staff always addresses patients or residents in a respectful, polite manner, even when the patient is impulsive, hostile, or behaving inappropriately. Respond positively. Affirm, don't abuse. Never yell. Use a quiet voice and calm tone, no matter what. Staff should never laugh at or belittle any resident under any circumstance. Insulting language of any kind is prohibited. Emotional abuse includes threatening or tormenting a resident. Never say things like, "I'm going to tell your daughter about your behavior." Threats, intimidation, or implied retaliation are not helpful and sometimes abusive. Regardless of how badly a resident may act towards the staff, remember to always respond positively. Physical abuse means obvious assault like hitting or slapping or kicking. It also means rough handling or using undue force to restrict or manage patients. Staff should never retaliate when a patient assaults them. Stay calm and maintain self-control. Abuse is wrong in any form. When frustration, anger, or hostility do occur, do not express these emotions to the residents or to the family members. Such emotions can be expressed with colleagues or supervisors. Neglect occurs when basic needs for nutrition, hydration, privacy, dignity, or safety are ignored and pose a threat to the patient. The patient does not have to be harmed in order for neglect to occur. If neglect produces harm to the individual, then the staff person is guilty of abuse. Imagine what it would be like to be neglected. You are the parent of a small child. It is time for the child to eat, and you notice that your spouse has set a gallon of milk and an empty glass out for the child. When the child does not eat, she simply decides that the child must not be hungry and takes the milk away. You express your concern that the child cannot open the gallon of milk by themselves. Your spouse tells you that they know how to take care of a baby and nothing is wrong here. Would you accept that explanation? How would you feel? Please stop the tape and think about how you would feel under these circumstances and discuss it with other participants. Remember, being vulnerable as an individual doesn't mean being vulnerable to abuse. Anyone requiring care also requires respect and consideration. It is the resident's right to be treated with respect. A resident or family caregiver may try to persuade staff members to give a resident special treatment. No gifts or extra payment should be received for due treatment or extra attention. Any additional compensation or gifts should be cleared through supervisors. Patients' rights extend to include privacy. Private matters about residents should not be discussed outside clinical meetings or clinical discussion. Written records should be safeguarded, and personal privacy or modesty should be accorded when possible. Knock before entering a room. Ask permission to move things within the room and help the patient feel in control of their environment. Be sensitive during bathing or toileting processes. Be respectful during daily living activities like eating. Imagine what it would be like to have someone disrespect your privacy. You go to the drugstore because you think that you have developed a yeast infection. You go to the clerk at the counter and, in a low voice, ask if he can tell you where the female medications are because you think you have an infection. The clerk looks up and yells to his coworker across the store that you have vaginitis and could he show you where the suppositories are. How would you feel if someone treated you like that? Please stop the tape and think about how you would feel under these circumstances and discuss it with other participants. Remember, personal issues are just that, personal. Privacy should never be a privilege or option extended to residents. Privacy should be automatically safeguarded. Safeguarding patient rights involves a professional attitude and attention to many small details that add up to dignity and respect. If patient rights are violated or a patient is abused in any way, it is imperative that it is reported to the supervisor immediately. The supervisor must inform the family and authorities will investigate and take proper measures. Abuse and neglect are never justifiable. They are always crimes.
Hello everyone and welcome to another episode of Clinically Correct. I'm your host Paul Carr, and today we have a special panel of guests and we'll be discussing ways of preventing abuse and neglect of residents. I'll ask the question and invite each of you to participate with your thoughts and comments. Okay, let's get started. Okay, here's the first question of the afternoon. You are assisting Ms. Jones during the bathing process and she is in the shower completely undressed. Another worker enters the shower area and begins to discuss how terrible her patient acts in the morning. What is the correct course of action?
Show support for your coworker by agreeing with the bad behavior.
Just watch the patient while continuing to talk to your coworker.
Just tell Ms. Jones to hang loose until the two of you finish chatting.
Remind your coworker that your patient is bathing and needs some privacy. Don't talk about residents in front of other residents.
Okay, let's move on to the next question. You enter the dining room and notice that Ms. Smith is sitting in front of her food tray without eating. The staff person assigned to Ms. Smith during dining is chatting with her friend while watching Ms. Smith. The dining period ends and Ms. Smith returns to her room. You suspect that Ms. Smith is losing weight because her clothing looks baggy. What should you do?
Maybe encourage the staff person to feed the resident.
Just go ahead and feed her yourself.
Just forget the situation. She has never been assigned to you, and her family doesn't care for her anyway.
Notify your supervisor that the resident seems to be losing weight and the staff appears not to be feeding her. Express your concern over weight loss and neglect.
Right, well, there sure are some interesting opinions. Let's continue. Ms. Jones pinches and slaps staff and other patients. Ms. Smith is a kind, sweet lady who never hurts anyone. You notice that Ms. Jones has just slapped Ms. Smith across the face. What should you do?
Slap her back. Give her a taste of her own medicine.
Hold Mrs. Jones's hands and tell Mrs. Smith to slap her back so she'll know what it feels like.
Hey, lock her in her room when Mrs. Smith is in the day area.
Notify your supervisor about the hostile behavior that is caused by her dementia. Ask for her doctor to decide the best way to evaluate and treat her aggressive behaviors.
Okay, moving right along. Ms. Grissom is your favorite resident and she wants to give you a present as a reward for your kindness. She offers you an old piece of jewelry that is not very valuable but very important to her. What should you do?
Take the jewelry. You wouldn't want to offend her.
Go ahead and take the jewelry, but don't tell your supervisor.
Take the jewelry, but don't tell anyone. It could be misinterpreted.
Thank Ms. Grissom for the jewelry and tell her that her appreciation is thanks enough for your hard work.
You hear two staff members talking about what happened to your resident the night before. One of the workers became angry after their resident spat on the worker and she physically held her down for 5 minutes. You are bathing the resident and notice that she has grab marks on her arms for being held. What do you do?
Keep that to yourself and don't tell anyone. You don't want your coworkers to get mad at you.
Don't say anything. You can't prove who injured the patient anyway.
Don't say anything because you will probably lose your job if you complain to a manager.
Inform your supervisor about the injuries and fill out a special incident form about what you know.
Okay, here's the final question of the day. Mr. Moore does not like minorities, and he often uses racial words. Now that he has dementia, he often makes racial statements. What is the best way to deal with the situation?
Call him racial names so he'll know how hurtful his behavior is.
Don't feed him or give him a bath on the day he uses the racial language.
I say let some of the other residents who are angry at his statement slap some sense into his disrespectful mouth.
Notify the nurse and administration that he's exhibiting dangerous behaviors that need attention from the medical team and stay professional.
And that does it for us on this episode of Clinically Correct. Thank you for watching us and thank you for your participation in the subject of preventing abuse and neglect of your residents. We hope you'll join us next time. Until then, for Clinically Correct, I'm Paul Carr.